As the largest public housing authority, we know how much of an impact we can make for the 1 in 16 New Yorkers who call NYCHA home. We are driven by the belief that housing is health and health is housing. It's at the heart of our mission. And so we work with our partners in both the public and private sectors to support the health of residents through engagement and collaboration. Since 2014, community health workers have been on the front lines of their communities, where they can make direct and immediate impact in supporting their neighbors. That's because our partners are hiring NYCHA residents who know the health and wellness needs of their communities best, as well as the approach to take to serve NYCHA communities to address health inequities.
A community health worker is a trained public health professional, and they are characterized by their connection to community. They have shared life experiences with the communities that they serve. They serve as a bridge between communities and the healthcare system, as well as between communities and other systems of care. The CHW role fundamentally is about trust. CHWs are really leaders in their own community, and that leadership role can come from a variety of things. Sometimes it's just, that neighbor down the block who is the sort of trusted helper that everybody goes to.
So we provide individual health coaching to help people to manage those diseases. So we do that in forms of education and support and helping people to set goals to help manage those conditions. We're community-based, so we're here in the community. We do home visits if the participant wants to, or they come to our office and do these individual health sessions.
The community health workers are really good at communicating with NYCHA residents about chronic disease management and prevention of any illness.
Is it a need? It is a need. It is a great need to have someone out there communicating on the ground, getting that information right from the tenants and right from the community, and bring that back to us so we can figure out. For me, it really hits home because I was raised in New York City Housing Authority, and I know what my family did not have. And I know that having this resource for them is life-changing.
We showed the value. We showed why it's needed. With people, blood pressure went down. Their A1Cs have went down. Less trips to the emergency room for asthma episodes. We can bring down medical costs, right? And uplift people.
I'm gonna say what I got out of it is how to actually have a conversation around tobacco addiction.
We were so excited to partner with NYCHA to launch the NYCHA Community Health Worker Program, in which we recruited NYCHA residents to train and intern as community health workers, and then to get jobs doing community health work in NYCHA. And we began this project before the pandemic. Actually, the timing ended up working out perfectly because they were needed to go and talk to folks about the pandemic, to talk about how to get tested for COVID, to talk about contact tracing, to talk about the vaccine. The need for community health workers is even greater now. Students were able to really serve their community in a time of need.
The NYCHA program that offers public housing residents a chance to become community health workers already has its first group of graduates with 13 residents.
The NYCHA cohort has completed. The students finished their training, they did their internships, they got their certificates, and they got jobs in the field.
I feel very blessed to be employed by this program. This is a wonderful program. So we basically team up with the public health corporations to bring the awareness and the resources to protect the community members during COVID.
What we looked for in a CHW was their personality. You're looking for engagement skills. How will that person engage with a stranger? We wanted to make sure that these people were compassionate. We wanted to make sure that they were caring. And we wanted to make sure that they knew what they were signing up for. And it's a lot of work, taking on, someone's information, their sadness, whatever it is that they're going through in their life. And you as a staff have to listen to that and then triage that and walk away from that with some results.
We know the community health worker workforce is a really valuable addition to our public health and healthcare system workforce. We know that they are effective in making positive health changes and producing positive health outcomes in communities.
I think the pandemic has showed that we need to have trusted people from the community out in the community, engaging people in their health, in preventing illness and managing illness. That is critical for our society. And here at LaGuardia, we have a lot of experience training community health workers from many different backgrounds. We want to be part of the solution and part of creating a stronger public health system in this country coming out of the pandemic.
We're definitely going to prove the need of having these community health workers in these type of settings. I believe you got to meet people where they at. And I also believe that there's so many people that have no idea how to navigate systems, and systems are so complicated and bothersome that people just give up. And those that are giving up, we want to be there to hold their hand and help them not give up.
We are so proud of this work to create pathways for NYCHA residents into preventive health careers while we connect public housing communities with new resources to support their health.